So what do we learn from this case? Well, although she'd been in decline cognitively for quite some time, there was little attention paid to her mental capacity. Only a couple of mental capacity assessments noted. And in particular, there was little attention paid to the series of unwise decisions she made in terms of declining care, declining carers, and when she was admitted to hospital on occasions, self-discharging or declining the opportunity to be supported in a delayed discharge facility prior to her discharge from hospital. Additionally, when the concerns amount to wandering off, and I'm going to change the term wandering off to walking about now, advisedly, there was insufficient attention paid to the risks that she was exposed to. There's some excellent guidance from the Alzheimer's Society, which the report I produced links to. And they advise, the first bit of advice they give is don't talk about a person wandering, because that indicates that whatever they're doing, wherever they're going, doesn't have a purpose, when in fact it may have a purpose. The person may have become disorientated as to time. And in January, as we all know, it's dark when you get up, dark when you go to bed. And she may have woken up and not realised in the darkness in the evenings when she walked away from her home and was befriended by local people, that it was even the night time. She may have been looking for something. She may have got involved in a task and then forgotten what she was doing or forgotten where she was going. But obviously, she put herself at significant risk. And what the Alzheimer's Society guidance suggests is the importance of trying to understand why the person is walking about. And they also recommend lots of helpful tips and hints for trying to safeguard a person who's begun walking about, such as creating a safe route around a garden area for them to walk, deploying assistive technology so that there's a sensor on the door with a pre-recorded message as the person's going through the door, involving local shopkeepers, and VM was very well known in Sale to local businesses, coffee shop particularly, the bank particularly, involving them to look out for her, having a sensor, having a tracking device. Lots of things can be done, but none of those things were considered in this case because there wasn't a proper risk assessment done. So my recommendations arising from this review are that the Alzheimer's Society guidance I've mentioned should inform a review of policy and practice, particularly in risk assessments, in carrying out risk assessments, and that a practice direction should be issued, drawing attention to all of the very helpful advice about understanding walking about and responding to walking about. So that should be included in a practice direction. So my second recommendation is that the learning from this review should be circulated to safeguarding adults boards in England, because when I looked for policies from other boards, I couldn't find any policies on walking about. So this learning may be valuable to other safeguarding adults boards. On the Friday before VM died in the road traffic collision, as I mentioned, both the GP and the social worker from adult social care were desperately trying to work together to safeguard VM, and they all, despite their best efforts, they didn't succeed. No harm came to VM over that weekend, although it did later. And so what I've also recommended is that a short guide for professionals in Trafford on crisis-enabled services, what the services that are available to professionals in a crisis, because there are lots of services which are not equipped to to respond in a crisis or provide 24-hour support, but there are some services which can. And so that's my third recommendation. The GP and the social worker from adult social care, as they were making efforts to try and safeguard VM on that Friday, the time started ticking away till we got to Friday afternoon. And we all know that Friday afternoon can be a very busy and challenging time as professionals who are concerned about someone's safety and welfare. The weekend's coming towards you, and we know that services will not be as available over the weekend. And it seemed to me that there wasn't an adequate system for ensuring that concerns that were being raised late on a Friday could be satisfactorily addressed. Been advised that since the time of this review, there's now a formal handover meeting at late on a Friday afternoon, and I've recommended that the Safeguarding Adults Board, that's Trafford Strategic Safeguarding Partnership, seeks assurance that that actually is working, and so that risks which are causing concern to professionals as we head towards the weekend are adequately covered. There was no multi-agency discussion in this case. There were bilateral discussions between professionals, but at no time, as concerns escalated about VM, was there a multi-agency discussion. And I have to say, I often find that in Safeguarding Adults reviews. Multi-agency discussions, strategy discussions are far more part of the way that things are done in the children's safeguarding sphere, less so, I find, in the safeguarding adult sphere. And so a further recommendation is the promotion of that multi-agency discussion. No safeguarding adults referrals were made, certainly. There were opportunities to make safeguarding adults referrals, first of all, when the concerns about VM walking about late at night were raised. And then in the days prior to the weekend, immediately before VM's death, a safeguarding adults referral could have been made. One of the benefits of a safeguarding referral is that it has the potential to lead to a multi-agency structure being put around the response. The self-neglect guidance for Trafford focuses on lack of self-care, but less so declining services. In VM's case, she was making quite a lot of unwise decisions to decline services. I say she was fiercely independent, but she was declining services which put her at risk. And that wasn't perceived as self-neglect. So I've recommended that Trafford's self-neglect guidance should be amended to make sure there's sufficient emphasis, not just on self-neglect arising from lack of self-care, but also from declining services. And then finally, mental capacity, some opportunities missed. I've recommended that all agencies involved in the care and support of VM should be asked what specific actions they're taking to improve their practice, the awareness of their staff in respect of the mental